Good afternoon, everyone. I am Brittany Clemens with WMBD News, and today I have Dr. Greg Stoner joining me today. He is with Heartland Health Services. He is the Chief Medical Officer, and today we'll be talking about COVID-19 vaccines, common questions surrounding the vaccine. So, as you know, Dr. Stoner, there are many questions surrounding the vaccine. People are hesitant about taking it. Can you talk about if people will be injected with COVID-19 if they were to get the vaccine?
The vaccines do not contain active COVID-19. The current vaccines contain a messenger RNA, and there's no way that you could get a COVID-19 infection from the vaccination.
And just to clarify, people who take the vaccine, they will not test positive for COVID-19 after getting it, right?
Right. They wouldn't test positive by the nasopharyngeal swabs that we do looking for the active virus. They wouldn't test positive for the antigen tests. They will eventually test positive for antibodies if they ever had an antibody test.
You know, another popular concern is that once they get the vaccine, they will be microchipped and the government will be tracking them. Can you talk about that?
Yeah, I've certainly heard this as a rumor that's out there, and no, that's not going to happen. There's no microchip in either of the doses of the vaccination.
And can you talk about how the vaccine works? You know, what is the purpose of a vaccine?
Well, vaccine is meant to stimulate your immune system so that you're able to fight off the next encounter with that offending organism. And so in this case, the two vaccines that are approved or that are pending approval in the next week or two are both what are called messenger RNA vaccines. And that means that you're getting some RNA into your cell, and it produces some of the spike protein, just some of the protein that's on those little spikes that you see on the coronavirus. And that then stimulates your body's immune system to generate antibodies, which are meant to fight off some foreign material, antibodies against the coronavirus. So that's how that vaccine works. Other vaccines work by taking a killed virus or a killed bacteria or part of a virus and injecting it into you to give you, to stimulate your immune response. But the two vaccines that are up now, as far as the Pfizer and the Moderna vaccines, are both messenger RNA vaccines.
So will taking the vaccine guarantee someone immunity from the virus, or is it just kind of just helping them, I guess, not get it?
I guess, you know, what has been published so far is that both of those first two vaccines are 90+%, 94, 95% effective, so probably not 100%, but nearly that. And
can you talk about if people will have to take a series of shots? Was it in phases? Are there a couple of doses? Is it something that we have to do yearly, like the flu vaccine?
Yeah, each of these, the first two, require two vaccinations. And they actually have a different time spread as far as when the second one needs to happen, but they both happen within the next 28 days. And then nobody knows whether you're going to need a booster a year from now or if that's going to change, because the virus could mutate and we could need something else, or we don't have good long-term studies to show how long that immune response lasts in us. In other coronaviruses, our immune response to those doesn't last all that long. So it may be that we do need this every year in the future, but right now, no one knows that.
And, you know, another common fear is that the vaccine was made too quickly. Can you talk about if a vaccine is effective with only being, you know, within a few months of a vaccine being created? Because typically, in the past, the vaccine's taken a few years before we are able to see it. So can you talk about if this vaccine is still effective, though it's only been a few months?
Sure. What I think of when I think of this is the chickenpox vaccine, because when it was developed, it took years to come out. And the reason for that is chickenpox didn't kill anybody. Okay, so if you were going to come out with a vaccine that prevented chickenpox, which made you sick for a couple of weeks and you had to quarantine for a couple of weeks, but if you were going to develop a vaccine, it couldn't hurt anybody at all, and so it had to be proven truly 100% safe. Something like this that's killing, you know, thousands and thousands or now hundreds of thousands of people in the United States, You want to have something developed and know that it's safe. And they've checked this, done this in, I think, somewhere 37 to 40 some thousand people, and have watched them for months now, and have looked for the safety profile and the efficiency of the vaccine and how well it works. And so that's what they've looked at this point, okay? And it looks like it is safe in short term, and it looks like it's effective.
And, what about herd immunity? Some people, can it be achieved if we don't have the vaccine? Can you talk about a little bit what is herd immunity, and is that something that is possible right now?
Yeah. So this virus works by jumping from person to person, from a host to another host. And if enough people have been infected and have antibodies to that, then the virus has nowhere to go. And so a substantial portion of the population has to get there, whether, I don't know the exact numbers, 80, 90% of people would have to have had the disease. That would leave a lot of extra dead people in Peoria right now if we counted on herd immunity as our solution. And
the Latinx, the Black community, and Native Americans, they have been overrepresented in COVID-19 deaths. But when it came to clinical trials, those communities were underrepresented. So, should the minority community should they have some concerns, some safety concerns regarding the COVID-19 vaccine, since there weren't that many in the clinical trials?
Okay, there were a fair number in the clinical trials, probably not exactly representative of our population, but there were a fair number. There weren't children in the clinical trials, so below 12, there's not really good evidence that it works. But I think that given what's known about the racial changes in the way the immune system would work, there's nothing for them to fear right now, and it should work in everyone.
So are you saying that race and COVID-19 doesn't really correlate together when it comes to a vaccine?
When it comes to the vaccine, no. It can. Some people have increased susceptibility to having more severe reactions to COVID, according to their race. But as far as the ability for the vaccine to work, there shouldn't be a difference.
And somebody takes the COVID-19 vaccine. Will it make someone more susceptible to other illnesses?
No, it should not make them more susceptible to any other illness.
And can you kind of talk about how the distribution will look like in Peoria County or in the Tri-County area?
I wish I could. It's something that's evolving as we speak. We're on a call with the health department and the emergency response system for this Friday afternoon, and by Friday evening the whole system had changed. So what it looks like is that they've identified 50 counties in the state to distribute the vaccine to, and they are the 50 counties that have the highest mortality rate. The Tri-County area, Peoria, Tazewell, and Woodford is it's almost like one area, and so, but the Tazewell County has statistically the highest mortality rate. So as I understand it now, the vaccine is all going to go to Tazewell County, but it should be shared among the 3 counties. It'll be shipped. It has a 5-day lifespan once it leaves one of those really cold freezers, and so it'll be shipped into this area and then distributed to the various partners that are distribution sites.
And, why are there different types of the COVID-19 vaccine? You have 2 developers. Can you kind of talk about why there are 2 and if people should be concerned that there are multiple ones?
That is an absolutely great question, and it gets to kind of the heart of the whole vaccine industry, in that there are different ways of making vaccines. The 2 ways that are coming up forward are those mRNA vaccines. But other companies for decades have made vaccines by other techniques, and they're still pursuing developing vaccines with those techniques, like killing a virus or cutting out part of the virus and generating the vaccine that way. So that's why other companies are coming up with other techniques of other viruses. and that's coming up with other techniques for developing a vaccine. So, okay.
And, do we have a say when it comes to our turn to take the vaccine, which one we want, or is it kind of just the doctor will give us what they think is best? How will that work?
Yeah, I don't know how that's going to work. The first one that looks like it'll be approved is going to be the Pfizer vaccine, and then probably a couple weeks later, the Moderna vaccine. And the initial parts will go out to healthcare professionals that are kind of frontline workers and those most at risk, and then the long-term care facility residents and staff, and then eventually essential workers, and then eventually the general population. But by then, I don't know how many vaccines are going to be approved and whether you'll have your choice of which ones, and so that's up for grabs now.
There's fear that that local governments will make the vaccine mandatory. Is that possible? Is that something that we could see, that the vaccine will be mandatory for everyone to take, regardless if someone wants to take a vaccine or not?
I don't see that as possible. I think that there are people that will refuse to take the vaccine on either kind of health belief concerns or religious exemptions or whatever, or just a fear of vaccinations. So I don't think the city or county or state or federal government can make it mandatory. A given business might make it mandatory for its employees, just as many healthcare organizations make flu shots mandatory.
And some are also saying that the vaccine is a bigger risk than just letting someone get cured of it naturally. What do you say to that? I would say the risk of the vaccine is far less than having the disease. And if you happen to have an uncomplicated case of the disease, that's great. But there's long-term consequences of this, even in healthy young people, that can end up with heart disease and other neurologic problems and other organ systems that are affected. And so it would not be a good risk to take, to say, oh, let's just give me the disease and see how it goes. So okay. If someone recovers from COVID-19 naturally, should they still take the vaccine once one is available for them?
What I have been able to encounter so far on that is that actually they're supposed to. I would think they will be probably last on the list of people that get the vaccine, but I would think that that's going to be the science at the time.
And will someone still have to wear a mask and social distance after they take the vaccine?
That's a great question. I don't have a great answer for that. I think that it's probably safe to not, but I would think that it'll be hard to know who's had the vaccine and who hasn't, like if you go into a restaurant or a movie or whatever, and I don't think they've figured out how to identify people that have had the vaccine and not.
And when do you expect we can return to our daily lives of not having to social distance, not having to wear a mask everywhere we go in the regular operation of business?
I think that'll be late spring, early summer before enough people have been vaccinated to make that happen. I wish it were sooner.
Okay, and I don't know if we have time to do some Facebook Live questions, so we're going to see if there are any for us to ask you. And can you kind of go over again, just because I think this was a big rumor, why it was even possible for someone to think that we will be microchipped with the vaccine? Does microchipping have anything to do with vaccines at all?
No, the microchip has nothing to do with vaccines. I think it was a rumor, and I've heard all sorts of variations of it, that Bill Gates was going to implant microchips in everybody, that the federal government was going to track us with microchips and all these things, but there's just absolutely no intent, or that's not part of this program at all.
Okay, I think that is... All right, I think that is everything today. Thank you for joining us, Dr. Stoner. If you don't have anything else for us today, then that is it. For those who missed the live or joined in late, it will be on our Facebook page and on our website, ciproud.com. For those wondering when the vaccine will be in our area, Illinois Governor J.B. Pritzker announced that we can see it in a matter of days, and we have more information on that on our website, seeourproud.com. I'm Brittany Clemens, live in Peoria.